Melanie Christie's 14-month-old son Zachary has no trouble keeping up with the family dog while playing in a Claremont park.
Foxy!
He's a healthy, energetic toddler. But before Zachary was born, doctors were concerned he might not turn out so healthy.
Wow.
Christie had already had 3 miscarriages before getting pregnant with him at 36.
When I saw my doctor, she, because of my age and because of my history, suggested that we do a maternity 21 test.
Christie had never heard of Maternity 21, made by a San Diego company called Sequinome. The doctor explained it would use just a sample of her blood to screen for Down syndrome and other chromosomal problems.
We went over to the lab and they drew blood right away to send off for the test.
In about a week, a nurse called Melanie with the results. The fetal DNA in her bloodstream looked perfectly normal. The test even revealed the sex of the fetus months before an ultrasound could.
The test was very accurate. Our son is very healthy and smart and bouncy, and he's great. We're so happy.
For Christie, one big perk was getting to skip amniocentesis, an invasive procedure that carries a very small but real risk of miscarriage.
1, 2, 3. Whoa.
Amnio used to be the go-to method for diagnosing Down syndrome.
Hi, Coco.
But when tests like Maternity 21 became available in 2011, that started to change.
We've now seen almost a 70% drop in amniocentesis throughout the United States.
Scripps Health's chief academic officer, Eric Topol, chalks that up to steep cuts in the cost of genetic sequencing. It's now easy to take a vial of blood and isolate DNA that doesn't match a patient's own DNA.
There's a lot of other different types of alien DNA that shouldn't be in a tube of blood, like it could be a bacteria or a virus, or it could be the first sign of cancer.
Early onset Alzheimer's, risk of premature heart attacks. Topol says looking at the DNA in our veins can uncover a whole lot more than Down syndrome.
We haven't even touched the boundaries of where this can go.
But tests like Maternity 21 aren't perfect. John Tarosi oversees prenatal diagnosis for Kaiser Permanente in Northern California. At a recent San Diego conference, he presented data on their shortcomings. Companies like Sequinome say their results are more than 99% accurate, but a significant number of Tarosi's patients weren't getting results at all.
When patients get the blood tests, and if they don't get a result, that's really a high-risk group. We found almost 15% of that group had a chromosome abnormality.
So getting no answer is actually cause for concern. Other results can be even more confusing. Tarosi says results for younger women flagging a rare and deadly condition called Patau syndrome are more likely to be wrong than right.
The marketing is ahead of the science, and in the early studies it showed very high sensitivity, but if you factor back in the no results patients, the sensitivity is somewhat lower. It's still a good test, but it's not 99%, it might be 90%.
There's a lot at stake when these tests deliver false positives. The New England Center for Investigative Reporting recently found that incorrect results have even led to abortions.
Let's take your shoes off, huh?
Melanie Christie understands test results aren't always accurate, but in her case, they were.
1, 2, 3. Voila!
I prefer having the power of knowledge beforehand so I can prepare myself for what's to come.
For most women, that's exactly what these tests do. Based on her experience, Christie would recommend it to anyone who asks.
Ainsi font
David Wagner, KPBS News.
petit tour et puis s'en vont.